Jane Frawley, welcome. So there's a bit of vaccine hesitancy out there. What's your view on whether everyone over 18 should get this vaccine or not?
I think it's really important for everyone over 18 to get this vaccine if they haven't had COVID in the last 6 months or if they haven't had a COVID vaccine in the last 6 months. Omicron has been very infectious, a little bit milder than previous variants, but still quite dangerous, and it's still important to have good immunity against the virus.
And what's happened with the waves over the last year or so?
So we keep seeing mutations. We've had Omicron and different variants of Omicron for some time now, and it's a little bit better in terms of hospitalisation and death, but it's still, of course, high risk for people who have a complex health needs or have a disability or who are over 65. So we see that immunity from COVID wanes quite quickly, so both from the vaccines and from the disease. So it's really important, if it's been 6 months, to boost your immunity back up so you don't get severe disease.
And so for people, say, in their 20s and 30s who might be thinking, okay, I've had all my vaccine shots, I caught it a couple of times, it didn't really affect me that much. For those people out there in that kind of mindset, what would you say to them?
I think that's a really common thought as well. I hear it a lot myself. I think it's still important to get the booster though. It just means that you're protected, you won't get severe illness and you won't have the long health complications. We're seeing a lot more long COVID in people who haven't had the vaccine or a booster as well. And if it's been over 6 months, then your immunity is quite low.
And what about also the argument that if younger people are hesitant about it, that they, in getting the booster, that they can ensure there's less of a likelihood that they would pass on an infection to our older people if they're around their grandparents, say?
Absolutely. So younger people move about our communities a lot more than people my age and older. Yeah. So they're out a lot and they're out together, so they can catch COVID and pass it around themselves, but also, of course, to family members and more vulnerable family members and younger family members, of course, too. It's important to also say that children aged between 5 and 17 who have complex health needs are also recommended to talk to their GP about whether a booster is right for them.
There was so much publicity around the previous injections, the vaccines, when they became available. Do you think the government should be doing more now to encourage people to get these vaccines?
Absolutely. I think the biggest question is why. So people are asking, why do we need another booster? And the reasons are really clear. So I think we could definitely have a little bit more communication about that so that people are really aware that the booster is really important and still really relevant for them.
What have you made generally about vaccine acceptance in Australia over the past couple of years, and have you compared that to what's happening in other countries?
Yeah, Australia's got an excellent record of vaccine uptake. We know that there was a little hesitancy around COVID, and I think that that's only very natural because we had a pandemic, a new virus, new vaccines, and there was a lot of questions around that. I think now that largely people understand that the COVID vaccines are safe and that they're effective in preventing severe disease. So we didn't see huge uptake of the fourth booster. We would have liked it to be a little bit
40%.
About maybe 44. So definitely under 50. And I think that in some respects it's due to COVID vaccine fatigue, not thinking it's necessary. I've had COVID disease, why should I worry? And I think the message really is it's important to keep your immunity high against COVID. So hopefully that message does circulate through the community and we see higher uptake of this booster now.
And even if you've had it previously and you're okay, if you pick it up again, there's a danger it might be worse the second time around.
Absolutely, and these viruses keep mutating too. So it's another reason we don't really know what's around the corner. So it's just important to have a booster and stay up to date with that. And maybe not think about the number of boosters. We just know at the moment that you have to keep your immunity high. So if it's been more than 6 months, then a booster is for you.
And what about these stories? You're someone who's very keen on as many people getting vaccinated as possible. What about the stories that we hear from time to time for people who have had really bad reactions to the vaccines?
Yeah, this is really important, and it definitely happens. So with the COVID vaccines, with the vaccines that are in circulation now, so the mRNA vaccine, we're seeing very low, very, very low, but still, it's still happening, cases of myocarditis and pericarditis, so heart inflammation, lung inflammation. All of those cases resolve very quickly. They're usually quite mild. It's really important to go straight to GP though if you feel any symptoms of those conditions. So feel odd, feel racing heart, just feel unwell, go to your GP, always really important. It's really important to say though that if you get COVID without a vaccine on board, you're much more likely to get myocarditis and pericarditis. So much more common from the disease itself than from the vaccine, and much more severe. And I think that message is really important. So when we compare risk, the risks associated with the vaccine are much safer than the risks associated with having a COVID infection without a vaccine.